and welcome back to the Postpartum Years podcast. Today, I have again with me Lynn Schulte. She is a physical therapist from Longmont, California, and we will be discussing diastasis. And we have so much more to talk about. Welcome, Lynn.
Thank you. What do you find postpartum with your clients that have a greater separation?
um, I have found there seems to be a lot where sometimes it's the fascia that just doesn't, because there's a, that can be, that has contractile property as well.
Yes.
So is it contracting? Is it just off? And sometimes I feel like there's some sort of code I have to find in this particular body, and it's different for everybody, which drives me insane.
I know, right?
It's like, I think I've got it. I think I figured it out for everybody. No, I
No.
figured it out for her.
Yeah.
Um,
Yeah.
but yeah, it's finding where the restrictions are. And one of the places I've found recently, because I'm doing a lot of work with educating therapists on the breast as well,
Oh.
the rectus abdominis muscle fibers and the connective tissue around them actually blend into the pectoralis connective
Yes.
tissue.
Yep.
So from the pecs and the rectus muscles from below, and that forms the circummammary ligament. So there's this ligament that kind of holds the breast in place. And I'm not talking about the breast flopping over like this. I'm talking, it prevents it from sinking down your body like this.
Oh, yes.
Flopping's one thing, sinking down is something
Yeah.
completely different.
Yeah.
So that ligament, if that's really tight, that's going to affect how the rectus muscles are and how
Mhm.
that connective tissue is around the rectus.
Oh,
So
fascinating.
mobilizing that, especially as those breasts are, you
Filling
get a
up,
lot of, right,
right?
you get a lot of change prenatally. So as during pregnancy, those breasts grow.
Yeah.
Um, but then postpartum, there's this sudden surge of growth as well, plus with the milk coming in, yada, yada, yada. If that's tight to start with, that can stay really tight. And for some women, that's one of the codes that needs
Wow.
treating to help get the rectus abdominis muscles to
Um,
sit where they're supposed to be sitting. So
wow.
that one,
Yeah.
and I'm gonna do like a case series report on that one, um,
Nice.
to see. So
Nice.
use my ultrasound, measure ahead of time, do the
Yeah.
releases, measure afterwards, and see
Oh, I love
where
it.
we are. But
Mhm.
also how the rectus is contracting at that
Mm.
point, because that's another thing. I can see a difference in an ultrasound picture beforehand where the rectus might be looking kind of really thin and sad, and
Mhm.
even the connective tissue is more grayish. And then when everything turns on, it's a much brighter, the connective tissue is much brighter. The muscles like plumper and more ready. It has more
Yes.
tone to it, that
Yes.
readiness to contract. And then when I ask them to do a head lift and I look, all of a sudden it's much plumper and it's
Great.
able to contract better.
Yeah, and what you're talking about there is the sausage, the casings of the
Yes,
sausages, right? You're starting with a flat sausage, and then you do the release work, or and then the muscles plump up, and they become the round sausages that we, like to eat.
right, right.
So that, yeah, I love that visual.
Yeah. So
That
it's not a matter of which exercise program is best. Sometimes it's a matter of, okay, what is preventing your brain from telling those muscles to be this ready?
yes,
And
yeah,
instead of like, yeah, we're still
we're
in the
sleeping.
pregnancy state, so we're just
Yes,
going to hang back here and tell me when it's over. I feel like
right.
that's what
Yes,
I'm,
yeah,
feeling sometimes.
yeah.
So getting those releases done and and seeing the changes immediately, where all of a sudden that person who had to push their elbows into the bed to be able to lift their head and shoulders now it just goes boom. And I love seeing how quickly that
I
changes.
I know. I think working with the postpartum population is the most fun population to work with because those changes happen so quickly. You
Hmm.
know, and it's like, people almost think that I'm, like, doing wizardry or something because there's just, like, it
Witchcraft.
witchcraft, right? But even the IRD, the intra-recti distance, can change so significantly with the oblique release and the recti release that I do.
Hmm.
I can take it from 3 fingers to 1.5 fingers instantaneously just by releasing the fascia that you were
Yep.
talking about, right? And the other thing for those, moms listening in who maybe are pregnant or were pregnant, there's a posturing that sometimes happens for women who are more shorter torsoed. So if you have a shorter trunk, that baby takes up space as it's growing, growing, growing. And what you end up doing is you kind of arch back and you lift the front of your rib cage up and you tighten down the back to make more room for baby. And now you're in this more rib flared thoracic extension, we might call it, but we're lifting our rib cage to like create more space and room for baby as it continues to grow. And then sometimes some women will fall into what I call the pregnancy posture, where when you go to stand, your hips are in front of your heels and then your ribs are flaring up to create more space for baby, and it really tightens down your entire back. Like
Hmm.
where your mid back area, think below your bra line, right below your bra line, that whole area can get really tight because they have to hang on for dear life to keep you upright.
Yes.
Because you are a leaning tower of Pisa when you are in this posture. And if you can just back your hips up over your heels, stack your hips up over your heels, and then figure out a way to just bring your rib cage down in the front and relax and get more movement, more stretching out that posterior rib cage area. Sometimes that can really help. Women who are in this posture where the ribs are tight in the back and they're flaring out in the front, those are your mamas that have more separation up high above the belly button.
Hmm.
And in order to really heal that separation above, we gotta help work with that rib cage and get it in a more neutral position versus what I call the pregnancy posture. And women who are in that pregnancy posture, it's like when they go to walk, they're letting the belly lead them. Their belly is like they're falling
Hmm.
into the belly. And we need to help bring and stack it more aligned so that we take the pressure off that abdominal wall. That pregnancy posture where our hips are in front of our heels, our rib cage is flaring, puts a lot of excessive strain on that abdominal wall and it tightens up the back. And
Hmm.
so, our body is like a suspension bridge where we need equal tension front and back.
Hmm.
With that big old belly, with that baby in there, it changes the dynamics from front to back.
Yeah.
And we need to figure out how to rebalance things after that baby's gone in there. And
Yeah.
sometimes it's, the front muscles have gotten turned off because we haven't been using them. They've been stretched to the gills with, baby being in there, and they need a little help to turn back on. And just like you were talking about that, they're off and then they plump right back up. It's
Hmm.
amazing. The body wants to function well.
Hmm.
It's just sometimes there's something keeping it from doing
Right.
so.
Exactly. Exactly.
And
And
that's
some
where if you can't figure it out, someone like Mary Ellen or I can help you figure out what you're actually doing there.
but sometimes there's also the case where things aren't going to turn back on because there might be a hernia. So there might
Yes.
be actual tearing or an opening within that linea alba, that connective tissue in between the rectus abdominis muscles. And in that case, it it can make it really, we can do everything we can, but our magic wands aren't calibrated
Sure.
to
And
to
what you're
things that
talking
need
about there,
surgery.
Yes. What you're talking about there is a deformation of the tissues, stretching out of the tissues. And there is an area where it's elastic, where it can recoil. And then if we take it beyond that elasticity, it goes into plastic deformation. And the analogy I like is that six-pack ring that keeps the six-pack together, that plastic that holds the six cans together. If you take that off and then you go and you stretch it just a little bit, it might be able to come back together. But if you overstretch it, that's the plastic deformation where it will never come back together again. And
Mm-hmm.
that's what creates those hernias in that linea
Mm-hmm.
alba. And that really that one area, I think of it as like a trampoline where there's a soft spot in the trampoline where it's saggy, and it
Mm-hmm.
doesn't have the spring and the bounce anymore.
Right.
That's
Right.
what's happening when we have a hernia. And usually the most common places are a hernia around the umbilicus, around your belly button is
Mm-hmm.
the most common place to have a hernia in the belly after being pregnant. And yes, we can do all the healing work, the strengthening work, but if that connective tissue, that linea alba gets stretched beyond its ability to recoil, there's nothing we can do for that, and surgery
Yeah.
really is your best option then. However, I wanna just say this, that I really would not recommend anyone get surgery for at least a good year, if not 2, after postpartum. Like, do everything you can to strengthen your abdominal wall as long and as much as possible before having surgery. You just want your muscles to be as strong as possible. The recovery, I think, will be easier postpartum if you do that. And
Yeah.
yeah,
And it also is also going to depend on, is there a hernia? Is there, how large is it?
yes,
Are they having problems? And in those cases, they may need surgery sooner.
yeah.
But one thing that I found in the literature, one thing I also found speaking to different surgeons, and I want to change this in the surgery world, is many of them call a diastasis purely cosmetic.
Oh,
And as a
yes,
PT, I will die on this hill. It is
yes,
not, it is functional. Somebody who
yes.
has like a 4 or 5, I personally, when I finally went in for surgery, because I did have this repaired, I had
Mm,
a 9 centimeter diastasis
wow.
um, that was 15 centimeters long.
Wow.
And I had two different surgeons tell me, well, that's just cosmetic. I was having, just my back, I was constantly going to the chiropractor
Yeah,
because my back was not stable. And
yes,
in circumstances where, somebody's abdominals have to come together
yes.
this far before they're able to contract and do the function, the
Yeah,
function that everybody else can do, it's it, to always have to work to set up to do like just that curl up
yeah,
is crazy.
yeah.
And to be able to have that function, we need to stop calling this just cosmetic.
I know.
That drives me literally insane.
I am right there with you up on that hill, Mary Ellen, totally on that hill with you, because it's not cosmetic. I mean, if this happened to men, it would totally be covered. It would totally be covered, and yeah, I'm right there with you.
Yeah,
There too many women are out there not having that function and having all this pain, and they can't get it covered by insurance.
right.
And it's just so sad. And that is, I don't know what it is today. Last I heard, it was like a 20 or $30,000 surgery,
Hmm.
you
Yeah,
know?
if you're going through plastics, if you're lucky enough to have a hernia, you can get it repaired um, because of the hernia. But because men get the hernias too with the diastasis.
Yeah. Don't get us started, everybody, on that. I think you can already tell where we stand with
Yes.
this. there are some great resources out there for women who who have a significant separation like you experienced, Mary Ellen. There is a tummy tuck rehab, has a program that, helps women who choose to go down that path and have the surgery and get the support of what to do and how to best rehab yourself after something like that, because there isn't really that much. There's not much research on abdominoplasty for significant separations with diastasis. And there's a PT and a personal trainer that developed this program that, they have both, one of them has gone through what you experienced, Mary Ellen, and they together have worked on putting this program together. So I just want to put that out there if anyone is dealing with this, because I think it is important to have support and to, know
Hmm.
what to do to best support yourself.
Right.
I had this client, Mary Ellen, who had a major separation. She ended up having, well, no, actually, well, she had a separation. She went and had surgery, but they didn't sew her up all the way. They only sewed her a couple of centimeters above her umbilicus, which left this huge bulge above it. And so she was trying to figure out what to do with that bulge. And I'm like, there's nothing we can do with this because you have
It's a
already been
defect in the
sewn
tissues.
up,
Hmm.
and so there's no rehab. So she actually had to search high and low to find a surgeon to undo the surgery and then re-put it in because it was mesh. They used mesh on her. And
No
so they had to
way.
find a surgeon to take out the mesh and then re-sew her back up. And then she re-injured it.
No.
Yes, yes.
Oh,
Yeah.
oh.
She was, on light duty taking care of little toddlers, and
Well, there you go.
right, the toddler darted off, and she, like, jerked really fast to save the kid. Her core wasn't strong enough to handle that reaction, and it caused another issue for her. So she's been through it, but just
Wow.
yeah, sorry to share the bad news, guys, but there's we just want you to know, for those of you listening in, that um there is rehab. There is rehab. There are things that we can do, and Mary Ellen and I approach your rehab very differently than traditional PTs who are just going to focus in on the exercise. And while that is good, there can be some good soft tissue work that needs to be done on your body to really help
Mhm.
approximate the muscles. But yet, there is that tissue deformation. And if it goes beyond that ability for the tissue to recoil, then there's really nothing that we can do. And surgery may be what your body needs. And like Mary Ellen said, every single person is different. There is no one size fits all. There is no one thing that can heal this for you. And you can try all the programs out there because there is a ton of programs. Do you realize, Mary Ellen, I've been doing this since 2009. I've been working mainly with pregnant and postpartum mamas. And back in 2009, 2010, there was nothing on the internet about postpartum rehab. There was like one program that I knew of. And now there's a gazillion out there. And so there's a lot of information on there. And I'm grateful for that because we're increasing the awareness of it. And I think Mary Ellen and I are on the same camp in that exercise can only take you so far.
Mhm.
And I think, especially in a postpartum body, there's some release work that can be super, super helpful in helping your tissues to recover quicker.
Mhm.
And so I just
Exactly.
encourage everybody who has had a baby, whether you feel normal or not, you could still benefit from a postpartum session of body work,
Mhm.
of body work and release work. And that's what allows your tissues to just function and work automatically like they're supposed to.
Mhm. Instead of, like you said earlier, doing 1,000 exercises in order to get the strength back, get in, get the releases done, and then the body can function normally.
Yeah.
then it's fair to ask the body to exercise at that point. But
Yes.
just going in and trying, and that's where I see a huge problem with a lot of the patients I see, because I'm in DC, so I have like really high strung people. They're very they're
Yes.
very
Yes.
type A. So, that baby's out and they are like trying to strengthen right away. And if everything isn't contracting, I'm seeing them with like massively overworked internal obliques. And
Yes.
the other three muscles are just like
They're taking
not,
a break. Yeah,
yeah,
they're lazy. And
yeah, because the internal oblique is just bullying the crap out of them. It's like, I've
right.
got it. I'm going to
Yeah.
do
Okay.
it.
So I want everybody listening in to understand that during pregnancy, if you look at the angles of the tissues of the abdominal wall, the oblique muscles do not get as stretched out as the transverse and the recti muscles from just pure physics, okay? Because the oblique muscles are coming in at an angle. And so they can work well after birth. Like they are the strongest of the group. And that's why they tend to become overworked, is because they can work easily. And those other muscles are like they're lazy. And we need to focus in on getting them stronger and allowing the oblique muscles to chill out a little bit. But if you only work the muscles that can work, you're just going to get those stronger and the other muscles aren't going to get stronger. And I say, especially for the pelvic floor muscles, I know this is going to be another episode for you and I know, but if you just focus on strengthening the muscles that can function, it's like beating your head up against the wall to get rid of a headache because that doing an exercise to get muscles that can't come to the party, you're only going to get the muscles that can
Hmm.
function and you're going to get them super strong. But
Hmm.
there that's where the release work comes in. That's where helping you to understand how to get the TA and the recti to come on board and help get the oblique muscles to chill out a little bit. It takes some coordination. It takes some retraining. And the core, all most of the core muscles are so affected by pregnancy and birth. And to think that we can just right away just go in and start exercising and getting them strong again, only the muscles that are able to function are going to get stronger.
Hmm.
Those that can't are going to stay weak.
Right.
And then you're going to have the imbalance. So
Hmm.
seeing a pelvic floor physical therapist who does manual therapy, not just exercise, I think is the key to postpartum healing.
Because any PT, they're going to look at somebody postpartum and just typically put them through an exercise program. It's going to be the pelvic PT, particularly who's a manual therapist, who would be looking at this a little bit differently.
Yeah. I
And
have a list of people that I have trained. So my students, I have a directory on my website. So if you go to instituteforbirthhealing.com and go to the other resources, the drop down list will be a directory and you can see if there is someone who has trained with me because they will have the manual skills to address the patterns that I found in the postpartum body. I know you're saying everybody's different, Mary Ellen, but in my practice, I only work with postpartum clients, and I did find some common patterns that
mhm.
kept showing up and showing up and showing
Yeah,
up.
there's some patterns,
Yeah,
but still, it's
it's
not
everything.
enough where I can go. It fits in this box.
Yeah,
I want
yeah,
to be
yeah,
able to
yeah,
put it in a box, and I can't.
yeah, yeah. I have found some boxes, so and I teach practitioners how to release and work and look for and release those patterns. And so if someone is in need and I know you've got an amazing practice in the DC area. I'm in Colorado. I'm in the Longmont area outside of Boulder. And so, please mamas get help, get support. Even if it's been 50 years, you
Yes.
still get
Exactly.
effective change. You're like, once postpartum, always postpartum in our mind, and your
Yep.
body is always affected from the birth. And that's why, you think you're fine when you're young, but then when you turn 50, 60, 70 years old, now you start having leakage issues and pains and issues. They're probably from your birth. And if you can get that taken care of sooner and get your body functioning well, you can avoid those issues
Hmm.
later on in life. I still find issues in my postpartum mamas who come in just to get checked up. They have no pain. They think they're doing great.
Hmm.
They're,
Oh
they're
God, yeah.
like, I'm good. I'm good. Birth was great. I still find things that we can work on.
Hmm. Yep.
And so I really do. It's my dream and my hope that one day every single person who's had a baby will get the care like what I'm teaching and what I'm putting out into the world and the care that you do with your clients. Every single person will receive that.
Hmm.
Because exercise, as you and I both know, exercise alone is not the key.
No, no, it's not. Is there anything else you would want to add?
Oh gosh. Well, I wanted to have you on so we can do other topics because this was kind of fun. This was really fun, Mary Ellen. Thank you for having me. And
Sure.
I just want moms to know that there is support for you and to please get the help that you need. Come in and get a session. I think that there's too much focus on babies after birth and not enough on moms. And
Exactly. Agreed.
moms, you need the support too. Um,
Hmm.
and having a session is probably the greatest thing you can do for you after having a baby. Come get support.
Yeah.
Do it. Spend the money on you. You're worth it. And I just wish we had the same attitude as France does. In France, you get like 8 physical therapy visits after having a baby.
Yeah.
And here, yeah, we just don't have the same support that we need.
Hmm.
So
Yep.
moms, take it, make it happen. Make it happen for yourself. So
Agreed.
you don't have to deal with things when you get older.
Agreed. Well,
Yeah.
thank you so much for imparting all of your wisdom, Lynn.
Thank you, Mary Ellen. Thanks for having me, and thanks everybody for listening.
Sure. Thanks. And we'll see you next time on the Postpartum Years podcast. Bye.
Bye.